The David Pakman Show at davidpakman.com.
Welcome back to the show. You can get the podcast commercial free, plus the bonus shows, plus the archive of shows dating back to August of 2005. As a David Pakman Show member, go to davidpakman.com/membership, Lewis. You can also go to davidpakman.com/March15, March 15. We've got a big guest appearance giveaway going on where a lucky member will get a guest appearance via Skype on the show. I know you're excited for that.
I'm pretty excited.
Mitt Romney urged Barack Obama to embrace the individual mandate for healthcare in 2009. This is a huge deal. This should be a campaign breaker for Mitt Romney. Lewis, what has been the number one issue from conservatives about Mitt Romney?
Number one issue from opposing conservatives,
right,
was his healthcare plan in Massachusetts.
Right, and what was his explanation all along for why he did that, but why you should still vote for him if you're a Republican in 2012?
Well, when he talks about it, he says that it works and it makes sense and that Obama should have asked him how to better implement his plan. That's
no, but
what
he said
says.
more than that.
Yeah, no, here's the thing. The Mitt Romney line has been, in Massachusetts, it was okay. The individual health care mandate was okay, but it is not something that should be done at the federal level. The individual mandate should not exist at the federal level. Well, it turns out, Lewis, that in July of 2009, Mitt Romney called on President Obama to require Americans to buy insurance as part of his health care plan using tax penalties as a backstop. In other words, an individual mandate, the same individual mandate he claims to oppose at the federal level, and the same individual mandate that Republicans oppose. And this is from a USA Today article, an op-ed titled, "Mr. President, What's the Rush?" which is available at mittromneycentral.com. Romney urged Obama to, quote, learn a thing or two about health care reform from his Massachusetts plan, which contained the same policy, and he touted it as effective. Now, Obama opposed that approach in his 2008 campaign. He wasn't even on board with it. Romney favored an individual mandate when Obama opposed it. Now, eventually it did become part of the bill that became law in March of 2010. Republicans hate it. Mitt Romney says, hey, it was good for at the state level. States should be able to do that, not at the federal level. This is a huge revelation. This could and should damage Mitt Romney's chances with Republicans, but we know he's going to wordsmith his way out of it. He's going to say, listen, I said he should look at it, but not that he should do it. He should look at it to know what it's like and then not do it. I mean, it's going to be a wordsmithing type argument from Mitt Romney on this.
Yeah, he'll have to weasel his way through this one. But he has already said before, publicly, that he would have helped Obama implement a federal plan. So, I mean, this kind of isn't new news.
It's not, no, but it's one of those, it's been kind of covered up by a lot of new statements.
Right.
And this is from remember, he says that there is a distinction between this using it at the state level and at the federal level. But the reality is that he implies the Massachusetts approach is ideal at the federal level. He doesn't make that distinction. He says the lessons we learned in Massachusetts could help Washington find a better way. That's pretty clear to me.
Yes.
But we have to assume he is going to try to wordsmith his way out of it. What do you think, Natan?
I mean, even without this news, this guy's a contradiction. I mean, he should be proud of what he did in Massachusetts.
But he can't be.
He probably is proud in private life. If you were to get him off the record, which he would never do,
ever,
he would probably say, yeah, what we did was great. And yet he talks about it as if he's ashamed of it, or as if it has no bearing at all on his position on what we should do nationally for healthcare. And now with this new news, we know that even that's not true.
I agree. Who knows what he would say off the record in private or what he thinks, but I think he will be the nominee, and I think when he is, all the focus will be on his flip-flops. Right now, when they're focusing on so many different GOP candidates, I think it's easy for him to weasel his way through this, but I think when the focus is on him only, it's going to be a much bigger problem.